Brilliant. We are now being recorded. Welcome everyone to Croydon BME Forum. This session today is about the coronavirus and the coronavirus vaccines. We wanted to give you, our community, an opportunity to connect with professionals, and we have three amazing people here today. We have Dr. Nnenna Osuji. Dr. Osuji, could you just say a few words quickly and a hello?
Hello, everyone. Good afternoon. It's a delight to be here. So I'm a haematologist by trade, medical director and deputy chief executive Croydon Health Services, and I'm really happy to be here to answer any questions you may have.
Brilliant. Thank you, Dr. Osuji. We also have Bolani Ayo-Wu. I hope I said that correct, Bolani. I'm sure she will correct me if I hasn't. Bolani, can you hear me?
I can hear you. Hello, everyone. It's awesome to be here. Thank you so much for having me. My name, humbly, is Bolanle Iyowo. I realized this morning I've been a pharmacist for 30 years. I didn't realize I'd been doing it for that long. I come to you not necessarily as a clinician and pharmacist, but once upon a time, sepsis used to be my bread and butter. Which means I'm very passionate about healthcare and critical care and everything that we can do to be in our fittest before we come into the safe spaces of critical care. I also come to you as a carer, and I also come to you as someone who has been into the COVID vortex. So thank you very much for having me.
Brilliant. And also, last but not least, Councilor Patsy Cummings. Welcome, Councilor Cummings. Please introduce yourself to our audience.
Thank you. Patsy Cummings, Councilor in South Norwood. I'm also really proud to be the BAME champion for the Borough of Croydon. And what that means for me is that I want to make sure that diversity and equality is central to everything we do in the borough, and this group is especially close to me because I've got a lot of second mothers in the borough, and many of them are in this group. So I'm passionate about our community. I've done a lot of stuff with the Windrush generation, and I'm just passionate to make sure that the health and well-being of all of our communities, but especially our BAME and especially our elders, are in the forefront of everything we do. So thank you for having me here.
Brilliant. Thank you so much. Thank you to all the speakers for offering to join us today. And thank you to everyone who's come on to have a listen or to have their questions and concerns answered. I'm just going to go through a quick bit of information. So this event is for those who are over 60. If you are between 55 and over, we are happy for you to stay and we welcome you. If you are under 55, you may find that our event on the 17th of March may be a more productive use of your time. What we wanted to do was to create an event where our elders could have a voice and an opportunity to speak directly with those who can answer their questions. So this session is being recorded and we're hosting this event for the sole purpose to provide our audience with facts and an opportunity to ask questions from the professionals who have experience in what is happening on a day-to-day basis. So this event is not to convince you to take or not take the vaccine. We welcome your stories, your experiences, and more importantly, any questions that you would like to ask. So if you have had the vaccine and you're happy to share your story, you are also most welcome to do so. If you've had the coronavirus and would like to share your experience, you're also welcome to do that. So yeah, if you do want to ask any questions or comment, please use the reactions functions, as I said, and then that way we will be able to see who wants to speak. So without further ado, I need to do a poll. So just before we start the session, we want to find out where you are at the moment in your thinking and how you're feeling. So we are going to do a poll. I'm hoping you guys can see it. I'm going to click launch the poll. You should hopefully be able to click on your screens the answer that you would like to answer, or use a mouse if you're on a computer to click. So would you be comfortable to take the COVID-19 vaccination? We have 38%. Oh, it's going up. It's going up. I'm going to give you guys some more time to do it. A few more seconds. Yeah, a little bit more time to answer. Okay, is that everybody? Okay, I'm going to click end the poll. Okay, and I'm going to share the results. So 38% of you have said yes, you are comfortable with taking the vaccine. And 19% have said not sure. 5% have said no, and 38% have said they have already had it. Okay, Andrew wants to take a picture, sorry. See a hand coming in. Okay, so I'm going to stop sharing that. And we do have a second question that I would like to do at the beginning as well. That hasn't come up. Okay, so I'm going to have to find the second question.
I think it's this one. One sec. Is it? Yeah. Okay. Yeah, it should be up now.
There we go. Great. So how informed do you feel about the COVID vaccination? So as things stand today, how informed do you feel about the vaccination?
Yeah.
Everybody click. We're giving you a bit more time to click how you feel. Wow, we have a lot of people who are very well informed, which is fantastic. 6% completely uninformed. 6%, oh, it's changing. A little informed, somewhat informed. Okay, we are going to give you a few more seconds to click, and then we are going to end. And I will share those results. So 48% of you feel very informed. 38% feel somewhat informed. 5% feel a little informed. 5% feel not very well informed at all. And 5% feel completely uninformed. Sorry, you can see Andrew jumping in there. So I'm going to stop that share. So without further ado, I am going to open up for people to ask their questions. So Lisa, Epiphany, Nadine, have people been posting questions already in the chat?
Questions in the chat box at the moment, and I'm not aware of any that came through the Wellness Centre email. Is there any update on that one?
No, there wasn't any that came through.
There wasn't, no.
So is there anybody who would like to speak? What I will do is ask Dr. Nnenna Osuji just to say a few words about your experience of the coronavirus pandemic as someone who's, you know, at the forefront of it at Croydon University Hospital. And then that will give people the opportunity to think about questions that they'd like to ask.
Thanks, Tracy. So I was actually going to reflect not on my experience at the hospital to start with. I'll start with my experience at home. In wave 1 of the coronavirus pandemic, it was intense, would be an understatement. And I was at work for 14 hours a day regularly. I have 4 children at home, and I would go from work to home. I didn't even realize that the seasons were changing until one day I found myself driving home and it wasn't as dark. I mean, really quite intense, just trying to keep day to day. And actually, when I got home, it was a different world. It was like nothing else was happening. We were in lockdown, we were safe, we were privileged, we were blessed. And it felt really, really separate. And so I could understand people not having a real appreciation of what was going on in the hospital. Wave 2 is different. When I get home now, my children know people who've had COVID. My children know people who've died from COVID. The degrees of separation between me and COVID at home is so much lower than it was before. So all of us now, I think, probably have a story around COVID that we may not have had in wave 1. I'll start with that. The second point I would make around wave 2 is that whereas in wave 1, and one of the ITU nurses said this to me, and it really, really hit home hard. We were saying goodbye on behalf of patients to relatives who were grown-up adults. So you were saying, you know, goodbye to people in their 80s, maybe in their 70s. It's not that discriminate. This wave, we're saying goodbye to people in their 20s, in their 30s. So this is something that is stealing lives. when we look at the lives that are stolen, and I will go back to wave one. I remember sitting at my office desk, and I wanted to look at everyone who'd passed away from COVID. And the first 5 people I looked at were young. They were in their 50s. They all had names that were not British names, and they were all men. And I really got alarmed, and I sat and I went through each of those cases and realized that they were, some of them were diabetic, some had raised body mass index or were obese. There were complications. And so it was very clear very early that this disease did have a different outcome for people from certain ethnic groups, for people from certain genders, for people from certain health conditions, and also people who were deprived. And there was a really good study. And I remember waiting, and I didn't want to hear all the anecdotes, all the stories that people were telling about a single case here and a single case there. We all knew from what we were seeing. And again, one of the nurses in ITU who, somewhere between wave 1 and wave 2, approached me in a corridor and said to me, Nnenna, when I looked around my unit and I could see people who looked like me dying from COVID, a beautiful young Black woman, that really, again, just highlighted it in a really strong way. But what we have had evidence of since is that people who get COVID, who are from a Black, Asian, and minority ethnic group, who are men, who are deprived, who are elderly, who are obese, who have diabetes, particularly uncontrolled diabetes, are more likely to die. And I'm not just saying more likely in the sense that, 1.5 times. This is up to 2 to 5 times more likely to die from COVID. So we know that this is a disease that is having a disproportionate impact on people who look like us. If you stack that up against the fact that many people from a BME background already suffer with disadvantage for many, many reasons. And George Floyd, which was very topical at the time, highlighted quite a lot of some of those reasons. We then end up in a situation where people may be doubly disadvantaged, double hit. So not only are people from this community more likely to pass away from COVID, and even if you don't pass away, there are some long-term consequences to having severe COVID. But we also then have this very community being the community that is least likely to take up the one weapon we currently have that is targeted at the COVID infection. Now, I have to say to you all, I'm not an easy person. I have to think things through before I move forward. So I took a bit of time to consider what I wanted to do. And I refused to preach to anyone around, you have to take the COVID vaccine. What I do find really hard, though, is for people to make decisions that impact their lives and by extension, the lives of their family with information that is being circulated that is so, so wrong. So if you make a decision based on information that is accurate, that's your decision to make. It's really quite dangerous to make a decision based on some of the conspiracy theories that have been circulated and abound. And that's the one thing my parents always said to me, knowledge is power. So all I would ask and all I want to be here to deliver to you today is any information. There's no such thing as a silly question. Any question that you might have that you've been holding on to bring some clarity. I don't look at information from one source. I need it to come from different sources so that I'm convinced. So I've looked at the Office of National Statistics. I've looked at the Public Health England data. I've looked at NHSE data. I've looked with my own eyes at what has been happening in my trust, where at any given time, we had up to 280 something people in our trust, in our beds, suffering from COVID, gasping for breath, where I've looked and understood 100,000 people who have died from COVID. And, that's just a number, but every single one of those people is a brother, a father, a mother, a sister, a friend, and the repercussions on the lives of their friends and families will be forever. So there's a lot to ask and answer about the vaccine, and I'm not going to preempt any of that. I want you guys to ask the questions as you see fit, and I'm here to provide any and every answer I have, and also where I don't have an answer to tell you I don't have an answer, but I will seek out an answer where one exists. I'd leave you with one last thing about the vaccine, which is I think probably the thing that took me a little bit of time for my own decision. It took some time for the research around the vaccine to be released, and that was part of my measured approach. And once I got that, I devoured it. But also, I was concerned that it was a new vaccine, completely new. And therefore, for me, you know, I'm a little bit more reticent about things that are brand new, and I need to be convinced. What has really helped my thinking is understanding that although it was rapidly progressed, it didn't take any shortcuts. This was thinking that people had in advance about if we ever got to the point where we had a virus X, what would we need to do? So people had the forethought about the planning and how they would engineer a potential vaccine. They put it together, and then instead of having to wait in a queue to be presented to regulators, they actually took all the other drugs off the queue so that everyone would focus on COVID. No one shortcut all the way through to be approved by our MHRA, which is one of the most stringent regulatory authorities around. There are many drugs that are approved in America that don't get approved here. So I knew that it had gone through due process, but even so, it had been trialed in hundreds of thousands of people, but it was still new. Whereas now, over 50 million people in the UK have had this without significant side effects. So every day that goes by, I feel greater and greater assurance around the safety. Even so, it's safety in a short term. So we now have data that's probably coming up to a year for the vaccine, but it's still short term. So I spoke to a virologist, a specialist. I don't have all the answers. I need to go and seek information as well. And I said, what about the long-term consequences? And there are a couple of facts to that, 3 facts. One will make you laugh. One was that she said most side effects from vaccines, and remember there's so many vaccines out there, occur in the first sort of few weeks and months. So we have that data. We know that if there was something to happen, it would likely have happened. So that was really, really useful. The second point is COVID is here. It's now. I would describe it as a clear and present danger. It's stealing lives. It's a tangible thing. So we have to balance that against the intangible, theoretical, distant, low risk of something happening in the distant future. And from all the evidence we have so far, unlikely. So that's another thought process. And the third, just to make you laugh, is I have a penchant for sweet things, including Coca-Cola. So Coca-Cola to me is designed, not in a good intention. It's not good stuff for the body, but I willingly drink Coca-Cola. So it felt a little bit irrational that I would consciously contaminate my body and yet choose not to take something that has been designed purposefully and positively for me. So little things like that, remembering that every tablet we take, common aspirin, paracetamol, is exactly in the same boat. These are all drugs that we take, knowing that no one thing is going to be 100% perfect. I wouldn't stand here and tell you that, but that we take it because we have a need, and the present need is really there in front of us. It's tangible. I just want you to make your own decisions. Oh no, someone's put how much sugar there is in Coke. Okay, I'm going to stop talking now. Over to you.
Thank you so much, Dr. Osuji, and thank you for admitting your sugar habit. I can see some questions are coming into the chat. Lisa, would love for you to ask the questions.
Yeah, no, I will go ahead. We have a question, is should you have a test before you take the vaccine?
So no is the answer to that. So even if you've had COVID, that doesn't stop you from having the vaccine. If you're unwell, not just with COVID, with anything else, if you have a fever and you have aches, pains, loss of appetite, you shouldn't take any vaccine, not just a COVID vaccine. If you've recently have COVID, we do recommend, spending a few weeks before you have the vaccine. And that's only so we're clear as to what you've got because of COVID, rather than any side effect from having that's the only sort of caveat to that. If you're unwell, pause. If you've had COVID, give it a bit of time, but everyone should be able to have the vaccine.
Okay, thank you. We have another question. Nadir would like to hear what is being done to reach individuals that are resistant in the age group of over 65s. I mean, this is one example of what we are doing as a community to reach the over 65s. And I'm sure there is, I'll hand it over to you, but this is one example of what's being done in the community.
Absolutely. And actually, I have to say, I might pass that question back to you. I stand up and talk about this and tell you till the cows come home, you actually have a bigger voice than I have.
Yeah.
And people who are over 65 who've had the vaccine without complication, you are the best advocates. You're the best people to reach colleagues, because I think that's where people trust. People are scared. I understand that. COVID has been hard. There's been a lot of information. There's been a lot of misinformation. I understand why people are anxious. But people who are over 65 who've had the vaccine, you guys are in the best place possible to reach and to have those conversations.
Patsy, would you like to also comment perhaps on that?
Yes, no, I totally agree. The way in which we need to try and speak to people is just by what Dr. Nnenna has already said, by providing as much information from the right sources as possible, because that's what it's about. People are able to make their own decision, but it's about informed decision, making sure that everybody gets the right information from the right sources, and so that you can make informed choices. There are lots of fears and concerns, we know that. And we all appreciate as well, coming from different BAME communities, the way that we have mistrust for all sorts of reasons. It's our historical issue. We're still fighting systemic racism in this country and many countries across the world. And we still have had examples across the world of things that have been done to people who look like us. So every one of us deep down knows what those concerns are, but I can't say anything more eloquently than the doctor's already said it. It's about having the right kind of information. So what are we actually doing? Forums like this, Zoom calls like this, because we're all locked down, we can get everybody in their own homes to be speaking to one another and talking about how they've had some information, how they've had the vaccine. Personally, those of you, there's many of you who know me and I know them, and I just want to thank them. They've been praying for my mum because she's been ill for a long, long time. And those of you who know me well as well know that she is a person in the whole wide world I love the most. And she's been in hospital a number of times for all sorts of different ailments. And she was in the top category to get the vaccine. And because she's bedbound and housebound, I'm caring for her at the moment at my home. She should have had the vaccine really, really early. And she was watching television all the time and seeing people half her age getting the vaccine. So I had to persist because different areas were rolling it out in different ways, because resources are being deployed differently in different places, and some are more efficient than others. And that's just a fact of life. This is unprecedented what we're trying to do here. So people who are housebound, it was they had to organise it. So last Thursday, a paramedic was organised to do the housebound, and my mum got her vaccine. And when she got it, she just burst into tears because she thought that was it. She thought she was safe. And I could not put my hand on my heart to say she shouldn't have the vaccine. I've had the information. My mum's had the information. She hasn't had as much information as me. But she had to have it. She wanted to have it, and I wanted her to have it. And like I say, those of you who know, I adore her. She's my hero. If I'm wanting my mother to have the vaccine, then I just want all of my second mothers with the information and based on your own choice. But I want you to do the thing that's going to make you all safe, because you have to be around for a lot longer to keep me in check. So that's what I'd say. But yes, information. So I'm doing another forum like this where I'm going to be speaking on Saturday with some psychiatrists. All of them look like us, which is great. I've never come across so many BAME health professionals in my life. I am so proud. So they're all coming out to say, look, it's coming from us. So we want you to trust us because we are you. So I'm doing one on Saturday. I'm organising another one that's across some of the London boroughs, so Croydon and about 6 or 7 other local authorities. We just need to continue to get the message out. That's how we do it, because to the questioner, it's not about waggling the finger and being told you've got to have it. It's about just making sure people have enough information, feel confident, and then will make their choice. And hopefully the choice will be to keep them and their loved ones safe. So it's about just making sure we can try and give as much information as quickly as possible, because we want it to be rolled out as far and wide as we can. And I'm just going to add to what Dr. Nnenna said. My penchant is Haribo sweets, so that's my guilty pleasure. I'll say no more.
Oh, thank you for that, Patsy. Thank you so much. We have another question. How can we build our immune system? And Stella, we'll come to you next to ask your question, all right? I haven't forgotten you.
Okay,
how
darling.
can we build our immune systems?
Well, does Bolani want to take that? Bolani, are you there?
Bolani?
Bolani, our health advocate? You might be on mute.
Sorry, a little bit of a trigger happy there. What was the question?
The question is, how can we build our immune system?
From Marie, thank you, Maureen. That's a great question. I think at the end of the day, from what my grandmother and mother always taught me, and if I've gone to school, university, and studied around drugs and the easy way out.
Oh, somebody. Oh, there we go.
The easy way out is to take medication when you don't need to. What we need to be doing in 2021, which a lot of us are doing already, is really thinking about what are we eating? What are we putting into our bodies? So I think a lot of it is about going back to basics and it is all about information, whether it be the vaccine, whether it be the nutrients in the food that we eat. And we're really blessed in Croydon, for those of us that are local to Croydon, that I believe we all are, we have an awesome market that we should and hopefully want to be supporting. We need to be thinking about how can we improve people's health from what we eat and what we drink from a community-wide perspective. So I think I want to try and take that question back to, for the people who are not sure yet about taking the vaccine, what are the barriers? What is it that they need to know more of, or why do they not yet feel that they want to seek the advice of healthcare professionals who have possibly already taken the vaccine, have done all the research? I think it's more a question of looking at the barriers to how do we build up our immune system. Those barriers exist. There's a wonderful community farm or two locally. That are we trying to bring that to the doorsteps of people that are around us? It's more about what we eat and drink from here on now, just to try and round up. Being a critical care medicine professional, one of the things that I always used to tell people was, you don't wait until you're ill or until you've had an acute hospital admission before you think about looking after yourself. We meant to train now as if we are training for a marathon. Today happens to be Lent. I am just following and supporting a team in my home. I've decided today is the first day of me not taking sugar again after falling off the wagon. So we all have our vices, but it's one step at a time and not believing you've got to do it all at once. So it's really about eating the basics, learning about nutrients, speaking to the right people. The sport is there, and chat to your local greengrocer. They're awesome. They're amazing.
Absolutely, that's true. Right, we have Stella. Stella, are you there?
I am, darling.
Stella, can you hear me? Do you want to go ahead and ask your question?
Okay, yeah.
Thank you.
Hello, doctor, and all the practitioners. God bless you all.
Oh.
I have taken my jab about 3 weeks ago. And I want to find out, please, if I can still pass it over to people, or can people be able to pass it over to me, please?
Stella, that's an excellent question, and it really gives me the opportunity to share a message specifically around hands, face, and space. So what the COVID vaccine does, it allows your body to produce antibodies to fight the virus, which means that when your body sees the virus, it will remember it and it will produce a lot more antibodies and hold it at bay. That means that you are therefore less likely to have a severe episode from the virus. You're less likely to need to go into hospital, you're less likely to go onto ITU, and you're less likely to pass away from the virus because of the vaccine. What it will not do, and people have not, they're still testing and trying to prove this. At the minute, our understanding is that you can still pass COVID on to your family members. And therefore you should still continue with the hands, face, and space, covering your mouth, washing your hands, using hand gel, and keeping a good distance from other people. That needs to continue. The more we have the vaccine in the wider population, the better the protection we all have for ourselves and eventually, hopefully, for others. But at this minute in time, the advice is still that the vaccine will reduce your risk of a severe infection, but you should still take precautions against transmission. I hope that helps answer your question. Let me know if not.
Yes, doctor. Thank you. But they told me that I have to wait for 12 weeks before the next jab. How possible is that, please? And why is that?
Good question again. And just to this is an honest conversation. So I want to share everything that has maybe made people pause. When the trials were done, particularly the Pfizer vaccine, for example, the schedule by which they gave the vaccine was a first dose and then a second dose anywhere between 19 and 42 days after the first dose. And on that combination, a few weeks after the second dose, you would achieve over 90% protection. And that was how it was rolled out, and that's what the company advocated. Soon after, and in the midst of a really difficult December and January, when the number of people developing COVID and coming into hospital with COVID was very high, there was some thinking, strategic thinking, that rather than having a small percentage of people having that high level of protection, it would be better to have more people having some protection, and that would therefore provide some protection for the population, reduce the number of people coming into hospital. So that was the thinking. Of course, what people have since done is to try and understand if instead of giving the second dose after 3 weeks, which was the recommended first approach, and giving it after 12 weeks, if the degree of protection would be lessened. So the degree of protection is not as high as it would be after your second dose a few weeks after, when your body has managed to make antibodies, but it is still high. And actually the evidence that has come out from Pfizer so far is saying that even with the 12 weeks, you are still getting good protection. Not as high as it would be if you'd had your second dose, but still good protection. So that was the thinking. It was reasonable thinking, but I think even that sort of threw a curveball in the way people looked at the vaccine. The Oxford vaccine is also similar. The percentages of protection are slightly different, but for the most, it's exactly the same approach in terms of the vaccination. So like you, I'm waiting for my 12 weeks to have my second vaccine. Like you, I'm enjoying some protection, and I'm privileged to have that protection. And I recognize that there are many others who don't, and I will wait my 12 weeks to have my second dose.
Wow. Thank you so much, doctor. You're a very clever lady.
No. Thank you, doctor.
Yeah. Patsy, we are praying for your mom. Your mom will get better soon.
Bless you.
Yes, by the grace of God, she will get better. Many, many prayers.
Thank you, Stella.
Okay,
Bless
give her my
you.
love. Tell her
Oh.
Mama Stella is praying for her.
I will. Thank you.
Oh, bless. That's lovely. Thank you, Stella. Thank you
Okay,
so much. We have another question. What is the mRNA vaccine and how does it work? And can you put that in simple terms, please?
Shall I attempt to take that one?
Yes, please, Bolane.
Okay. What it is that it's The mRNA vaccine, it's something that gives an instructions to our cells to make a harmless piece of something that's what's known as, it's a protein, it's called a spike protein. Just have that word in your mind. That spike protein, it's found on the surface of the virus that actually causes the COVID-19. So with these vaccines, they're given in the upper arm, and then once the instruction, which is the mRNA, is inside our immune system, inside our actual immune cells, the cells then use them to make the protein piece. After that protein piece is made, the cell then breaks down, and then, you know, it just gives an instruction to get rid of them. Now, when the cell now displays the protein piece on the surface, the immune system recognizes that the protein doesn't belong there, and it begins building an immune response and making the antibodies that we may or may not have heard about. And that's something that happens in any natural infection. So at the end of all this convoluted process that even I don't understand fully, our bodies have learned how to protect against future infection because those antibodies have been made. Does that answer your question sufficiently?
Yes, thank you. Sorry, that was me. Thank you.
I think it's a great question because it is very confusing with some of the stuff that we've heard out there about, you know, what the vaccine is going to do within our bodies and how it's going to change our DNA. And that's not the case. It's like a fable that's grown from an age-old way in which vaccines work. Some vaccines just work a little bit differently, which this one does. Thank you for the question.
Thank you. We had Sheila that had her hands up. Sheila, where are you? You okay? Do you want to go ahead? Sheila, Sister Sheila? Sheila,
you're on mute. You'll have to unmute yourself.
Can you hear us, Sheila? Yeah. You need to switch off mute. Unmute yourself.
Okay, yes.
Yeah. Hi, Sheila.
Yeah, my question is, I had the vaccine about 2 weeks ago, and now I'm awaiting for the second one, which is on the 12th week. Will I get the Pfizer? This is because that's the one I had first. Will I still get the Pfizer one? And if not, if they gave me something different, will it work?
Sheila, my goodness, you guys saved up all the good questions. Is that it? So the answer is yes. You should have your second dose of the same vaccine you had for your first dose. And the supply of the vaccine has been planned in that way. So they automatically book you in for the second dose of the exact same, vaccine. Your second question, if you had a different one, would it still work? So the answer is, if for any reason, and I can't anticipate any reason, you didn't get a second dose of the Pfizer vaccine, what you would be getting is a first dose of another vaccine, and you would then have to have a second dose of that vaccine to complete that vaccine course. So in a nutshell, you had Pfizer, you should have a second dose of Pfizer. The supplies have been planned to make sure that happens. There's no reason I can think of for you not getting it. Good luck, and I hope it goes well.
Thank you very much. Thank you.
Okay. We have another question. What if the vaccine cannot be taken in the left arm? Someone says that they are unable to take the vaccine in their left arm.
That's not a problem at all. Give it to you in your right arm. The vaccine is an intramuscular vaccine. The easiest muscle to give, well, I don't know if I call it muscle, but the arm is the easiest place to access, but it can go in either arm. It can even go in muscles in other parts of your body. So that's not a problem at all. Don't let that stop you.
Thank you. We have Andrew Connage. Do you want to ask your question?
Yes, thank you very much. I'm not a Croydon resident. Yes, I'm not a Croydon resident. I'm a Brixton resident, but still.
That's okay. Welcome.
We all share the same community and say, yeah, just a quick one, perhaps to the doctor or to the pharmacist. And it says this question has a bit of a cynical kind of thing. Yeah, as a doctor quite rightly reminded us, Black men have been disproportionately represented in the kind of people that have actually had severe COVID and mortality. However, it seems as if, although that statistics is there, yet when they're looking at all the priority groups, somehow that isn't reflected in the government's kind of rollout of priority groups. So here I am, I'm 64, right? Yeah, I've had to kind of battle against diabetes, I've had to battle against hypertension, right? And thank God, seems to be sort of, getting the better of it, etc. And also my BMI is sort of higher than it should be. But yet, I don't somehow quite meet the criteria to say that I should need the vaccine. I have to continue waiting anxiously for when eventually it comes around. And I'm thinking to myself, well, what's the value of actually telling me about statistics about people of my kind of gender and race, right, being at such a high risk, but yet, I still have to be waiting anxiously. So if you see what I'm saying, it's almost as if, well, the statistics serve one purpose, but it doesn't serve the purpose of the people who are the ones who make up that statistics. Thank you.
Can I just throw something in there? Although I am really pleased that I was invited to come here today, because fortunately, I fell into the COVID vortex at New Year's, and it took me probably the best part of a month to sort of get rid of pretty much most of the symptoms. And I did a lot of thinking whilst I was in my bed in isolation, not allowed across the living room border, so to speak. That we know that the health, social, and well-being landscape there's an inequality there. And that is what underpins a lot of the reasons why the decisions that don't seem right to us and possibly are not right to us. And I say that as the mother of a Black Generation Z and as a Black woman, it's not until something hits our doorstep that we realize how powerful our voices could have been. And yes, we may have been saying this for a long time, for decades even, about lots of different infections and diseases and whatnot, but we need to think smarter about how we go about impacting how those decisions are made. And for me personally, and correct me if I'm wrong, anybody, the reason why they have to decide on going with one group over and above another is because somebody has sat down in a room and has made that decision. Now, we need to make sure that our representation is there, and we need to just go through every single tactic to make sure that our voices are heard, so that we do reduce the health inequality. And that's what health advocacy is all about. So I appreciate what you're saying, sir, Andrew, but it's a question of we need to do more, and it's not going to be other people doing it, it's gonna have to be us. I'm a lifelong learner, so I'm very much wanting to hear why people feel they should be heard. And when they're not being heard, how can we better support those people? Because that's what's going to bring about better health. I'll hand over to Dr.
So, thank you. And so I really like that question. And that's what we should be asking every time with whatever information is given to us. Question the data, question the logic, triangulate. That's exactly the thinking we want. So it's a brilliant question. So when I spoke to you about the risk factors of passing away from COVID, I mentioned a few. Just to put it in perspective, if you are over the age of 80, your chance of dying from COVID is 10 times the risk as someone who's between the ages of 50 to 59. And for that reason, people felt that that was the highest risk category and the first target group for vaccination. If you are obese, your risk of succumbing to COVID is 2.5 times higher than someone who is not classed as obese. If you are a man, I've just lost the gender, you are roughly twice as likely to pass as if you are a woman. If you are from a BME background, similarly, twice as high as white colleagues. And the list goes on. If you have uncontrolled diabetes, you're looking at maybe 3 times as high. So each risk factor has a different risk category or risk multiplier And if you happen to have more than one, then that's compounded. So you're absolutely right. And there are further discussions happening about how we represent that risk in meaningful ways. In amongst our NHS staff, we do a risk assessment, and it recognizes the fact that if you are male and Black and over the age of 65, your risk assessment is really high, and that influences how we protect you in the workplace. So we are looking at that. But in terms of the vaccination priorities, because the risk of death over the age of 80 is 10 times higher than someone who's 50 to 59, they started with that group. I think there's still a dialogue and there's still a conversation to have. I am part of those conversations. We'll continue having the conversations, but I hope that gives you some context as to why they've started in that way. There's one other point I would like to make. And when this first came out and people said, well, Black people are dying or people from a BME background are dying, there was a lot of debate around why. And, you know, one of the things was, well, it can't be genetic, because if this were the case, then people in different geographical areas would also be succumbing in the same way. Even allowing for the fact that we don't know what is measured and what is not measured, that didn't seem, so this is not about genes. There are many factors. Some of it is about coexisting conditions. So Black people are more likely to have diabetes, more likely to have hypertension. Those are things that then increase your risk of succumbing from COVID itself. There are other factors, and I'm actually looking at a lot of data at the minute. I love data, so I'm very sad in that way. When we look at populations, and I've asked our colleagues in Southwest London to look at our population that we serve, the people who come to be tested for COVID, guess what? Fewer Black people than white people choose to be tested. So that's one. The second bit around how many people come to the hospital when they have an infection as opposed to stay at home and try and work it out, it's going to be another consideration. Someone has just put in the chat vitamin D, and there's more work coming out around vitamin D, and we know that there may be relative deficiencies. All of this is stuff that we're still trying to get to grips with, because there are many, many reasons why this is the way it is. And I would talk about biological reasons. I would talk about cultural reasons and social reasons. And I would also talk about genetic reasons around different diseases that might be more predisposed. So there's so many different factors. But sir, you're absolutely right, Andrew. I love that question. But because you're 10 times more likely to die over the age of 80, they started there.
Can I just add a little thing there, Andrew? I think it is an excellent question, and the two contributions already covers most of it. But from a political perspective, I totally agree that there needs to be a lot more work done for us to have that voice to make those different changes so that things are rolled out differently based on the data. And yes, over 80s, and if you have got underlying health conditions, absolutely. But who would have thought 2 years ago, if a government had said to its people, we are going to keep every single person over 70 indoors for 9 months because someone has told us that they are more likely to be attacked by this virus, no one would have believed it, but they shielded everyone over 70. When the statistics came out to talk about how it was affecting, for all the reasons that's already been mentioned, but it was disproportionately affecting the BAME community, what happened? Another report was asked for, some further research was done, and maybe that should have been done, but more quickly, so that we could then have been in a position where we were treated the same way, that they were prepared to shield everyone over 70 because the evidence suggested that that was the right thing to do. So Andrew, we just need to get more people at the seat of the table to make those decisions based on facts and figures and stats, but that so once that information comes out, we can shout and scream on behalf of our communities to say these things need to be done as well to protect our people. So yeah, brilliant question.
Thank you, Patsy. Is there any other questions, anybody? Do you have any other questions? Esther, you've got your hand up. Do you want to take yourself off mute, Esther? Yeah? You got your hand up, Esther? I can see you. I think you need to unmute. You haven't? Yeah, that's it. Yeah, okay. Go ahead.
Why aren't GP surgeries allowed to give the vaccination?
Sorry, Esther, was that why aren't GP surgeries?
Why aren't they allowed to give?
Okay. So again, this is about logistics more than anything else. The first vaccine that was approved, the Pfizer vaccine, needed to be stored at -80 degrees.
Okay.
And that's not something that would have been easily done at every single GP practice. You also had to use the full tray of the vaccine, otherwise you would have wasted it, which feels like the wrong thing to have done. So that was mainly the consideration. They then also wanted to make sure we coordinated our efforts so that we can get to most people as quickly as possible. So they looked at making sure there was always a site at least 10 miles from where you were. And so they looked at what we call primary care networks, which are groups of GP practices that all cluster together and support each other. So they looked at making sure in every sort of PCN area, you had one practice that did it. So it should be able to provide for the neighborhood. That was the sort of level that we were looking at to deliver. And then eventually, and Patsy, I'm glad it's happened, we then moved to the delivery at home for people who were not able to come out. It took a few steps for us to get the logistics right, but that was why it was done in that way. And Patsy, can I also send my prayers for your mom?
And for me.
Oh, Esther, and for you.
Yes,
and for you.
So we have another question. A take up of the vaccine by NHS BAME staff is half of white. Is there any ideas at why this is, given that they might have been the most eager participants and the greatest advocates for the vaccine?
When everyone goes quiet, do I step in? I'll step in. Let's go. Well, NHS staff are people like you and me. We're having this conversation because we're all people, and people have the same anxieties. They get the same messages. They get the same misinformation. They may not have as much time to sit and filter through the evidence. That, you know, particularly in Croydon, where 70% of our staff come from Croydon, we're talking to, you know, our communities really. And also people have taken a little bit more time. So it's not that, I don't think this is where we've ended. I think this is where we've started. And if you look at the people who are coming forward to be vaccinated, more and more people are coming forward now as the volume of people vaccinated without complication increases. So people have taken a little bit of time to do that, and it hasn't been uniform. It's not uniform anywhere. So exactly the same misinformation that abounds in the minds of people who haven't had the time to read the evidence in exactly the same way. There is probably one group, and I will talk specifically about our nursing staff, and particularly our women who are young, because I know that one of the questions out there has been around fertility, and that has caused people to hesitate a little bit as well. And because most of our workforce is from a nursing background, many of our nurses are women, many of our nurses are young women, that's going to have an impact as well. The Royal College of Obstetrics and Gynecology has been very helpful in issuing guidance, and they have demonstrated, now people have had time to look at this, that the impact on the babies is not there. Breast milk, it's safe to feed after the vaccine. So we now have more and more evidence and data to support people who've been hesitant for that reason. I think there's a little bit of work we need to do around peer pressure. So you making your own decision is really important, using the data. People around you, if they're undecided or anti, should maybe hold their own counsel and use the data so that you're allowed to make your own decision as well. So there are a number of factors, but we keep working on it. And I think we're starting to see more and more people come forward as they slowly get to grips with the data and get the assurance of more people being vaccinated from their own communities.
Can you hear me? I would like to ask a question, please.
Yes, go ahead, Linda. Thank you. Thank you, Doctor.
It's Lynn. I've got underlying problems. I've been in hospital twice with allergy, twice almost died with allergy. Should I take the injection? I'm afraid because of what happened to me in the past. I'm afraid to take the injection, the vaccination. So I would like second opinion, please, on my allergy. I've got the pen that I have to walk with in case I've got an allergy to inject myself.
Lynn, you are amazing. Thank you for bringing this to the top of the table for discussion. So this vaccine has been proven to be safe in so many conditions. You can have rheumatoid, you can have you can have HIV, you can have so many other conditions, sickle cell anemia, you can have the vaccine. You should always speak to your specialist, of course, but you can have the vaccine. There's only one situation where we have paused, and that is exactly what Lynn has just described. If you have a severe allergy that is life-threatening, that requires you to hold an adrenaline pen, we're not giving the vaccine at the minute because the only side effects we've seen, and they are minor, was that sort of early allergic reaction. It never reached a point of anaphylaxis like you've described, but because of that, we have held off in anyone in your particular context having the vaccine. So for you, I would keep advocating the hands, face, and space more and more. I'm really sorry, but it's the only caveat to the vaccine that we've had at the minute. And
Thank you.
we may call, but at the minute.
Thank you.
Okay.
Yeah, stay safe, Lynn. Stay safe.
Thank you.
Stella, go ahead.
Yes, please. It's me again.
Yeah, that's fine.
Yeah. Dr. Nnenna and your group. Unfortunately for me, my husband died of corona or coro almost 1 year ago in my hands in Lewisham Hospital. So what I'm trying to say, I'm still mourning my husband because he's a very loving, caring man. I want to say, take it out of my mind that if this vaccine has been around at that time, my husband will have still been with me now. It's so unfortunate that this vaccine was not prepared on time to save the life of my husband. I'm just being emotional. So that's it, my dear.
Stella, I'm so sorry. I'm so sorry for your loss, and I can hear your grief even now. I'm sorry. We all wish that we knew more, that we knew what we knew now at the beginning of wave one. We've had to learn so much, and so much of what we've learned hasn't come in time to help people who we've lost along the way. I'm so sorry for your loss.
Thank you, my dear. Thanks. Thank you.
Stella, thank you for sharing.
Yeah. Thanks,
Lisa,
I
will like to ask and condolences to you.
Yeah.
Hi, is that Puna?
Yes.
Hi, Puna. Go ahead. Thank you.
I had the first vaccine in December the 23rd. And they did give me a date for the next one in January. Then they phoned me in January and say they will give me till in March, the second one. So I want to know if it will work. And, I don't know if they will get in touch with me. So what should I do? I had it at Parley Hospital.
We will be in contact. You will get your second dose within the 12 weeks. It sounds like that's about the right time for it. So you should definitely be booked in to have that. It sounds like you have a date. Did I hear that correctly for your second dose?
Puna? Puna? I think she did say that she has it's due in September. I'm not sure if she gave us a date. Did you give us a date, Puna, for your second vaccine?
No.
You haven't got a date yet?
No.
They've just given you, did they just give you a month?
That's right, correct.
Okay, but not a specific date. So will that be followed up by a letter sent to the home address?
They didn't send no letter. All what they're doing by phone.
Text, yes. So you should get a text with a date for March. If you're not hearing anything, and all my GP colleagues will shoot me for this, but I'm going to say it anyhow. If you get to the end of February and you haven't heard, you might want to give them a call, but they've been very good. I haven't heard of anyone who has missed a schedule, and they are really tightly making sure they follow up on individuals. So it's likely you'll get a date towards the end of this month for March.
But who do I call? Do I call my GP?
If not, I would call your GP, but I anticipate you shouldn't need to do that, hopefully.
Yeah, I think I think that might be one of the concerns, that once everybody has had their, like from this group's perspective, is that once they've had the vaccine, and some of them have had the vaccine, is that when will they be notified? So I think like maybe when they're going to have the vaccine, is to ensure that they know that they're going to get either a text, that there's some form of communication which is going to be followed up, that's going to be done through, like, you know, a letter, an email or a text, but they will just have that reassurance. Thank you, Nnenna. Can we go to Constantina, because I know I was going to ask your question in the chat, so you may want to ask it now, and then I will come to Elsie and Esther. Did you put your hand back up? Yeah, so we'll do Constantina, Elsie, and then Esther. All right, so do you want to go ahead, Constantina? Thank you.
Thanks. Firstly, call me Penny, because my first name is actually, yeah, just call me Penny. It's easy.
All right then, Penny. Thank you. Welcome.
No problem. I think I'm going to be, it sounds like I'm going to be the one dissenting voice here. I have no intention of taking the vaccine at this time. I am not swayed because of misinformation. I'm a highly intellectual, intelligent woman. I've got degrees galore. I have done exactly what Dr. Nnenna said, which is to look at the data, look at the research, not just here. I've actually taken my time to look at it all around the world. I put earlier on that I cannot imagine being persuaded that someone could produce a vaccine in 10 months. I can't imagine being persuaded by that, but I could be persuaded by what Dr. Nnenna suggested, which is that they were looking at this a long, long time before. So that worries me then, because I then think, so you kept it from the world. So you knew it was coming, you didn't tell us. But either way, I'm not going to take the vaccine. And I think it is because I do not accept that there has been enough time to know what the effects will be. And I say that because I've just had COVID very badly. And they're now telling me I've got long COVID. But what's interesting is 4 months ago, they were saying, these are the symptoms of COVID. And then that's changed. And then they were saying, after COVID, this is what you can expect. But now, 10 months on, they're now saying, actually, there's a whole load of other things that could, symptomatic COVID, but also that I'm telling the people about my symptoms now after COVID. Originally, they were saying, no. But now there's so many people saying, my eyesight's funny, my this has been affected, my that has been affected. I don't know absolutely that it's because of COVID, but my view is neither do the doctors. So we need time, don't we? We need time to actually see what's happening. So I'm riding on the crest, like you said. I've had COVID terribly badly. I must have some antibodies. So I know that can protect me, and I have no intention of putting anybody else at risk. So I don't intend to take the vaccine at this time, but I would never dissuade somebody else from taking it. I would say to them, make your own judgment. And if you think it's right for you, don't listen to all this nonsense conspiracy theory, because it ain't going to help us. Go back to the data, look it up for yourself, and not just the data here in the UK, look around the world and see what's coming out. I feel passionately about what happens to Black people. And that's why hell would have to freeze over for me to believe that they're really, really concerned about Black people, and they want to do the best for us, and because they ain't doing it in any other of the fields of health where we know Black people are more disadvantaged. So I'm like, yep, okay, I'm not prepared to accept what the government's saying. And I'm not one of these hysterical people. I've worked in health and social care for 35 years. So I might sound negative, but my view is do your own research, do your own checking of the data, talk to other people, hear not just 2 sides, the 10 sides, and then say, this seems right for me. Right now, it isn't right for me.
Can I jump in there? Can I just say a huge thank you to Penny, and I just wish that there were more Pennies in our communities, because you've touched on, I think, pretty much all the points that people like myself and yourself want people to have considered. I feel that the overarching thing is we want people to make an informed choice. Yes, there may be people who are not respectful of other people's decisions, and they may be saying, oh, this person is listening to conspiracy theories and that's why they've chosen not to. I don't feel that we as this group, and everything that I've heard about this awesome group, is a safe space where those people reside. So what I'm hopeful is that there'll be more people that go about things in the way that you do. And thank you so much for emphasizing the fact that you have no intention of putting anybody else at risk. That to me is the type of person that I want next to me in my community. That's how we're going to get past this. That's how we're going to get beyond. Dr. Nnenna was saying that we're human first. I haven't had my flu vaccine. And I remember being asked, why hadn't I had it? I booked it. I didn't remember that I'd missed it until 7 days later when I was still in bed on all fours with COVID symptoms. And one thing that I do want to say to Penny is that medicine and healthcare, it's an evolving beast. It's scientific, but in some ways it's organic. So the symptoms that you may be alluding to, there were loads of neurological symptoms that weren't being picked up in the early days, that were not actually ascribed to your being of one genetic background or the other. And it takes time to pick that up. And I guess I understand and appreciate it more than the average person because I have a background in critical care. But as a carer, holding the hand of a relative in a critical care bed in February and March of last year at the beginning, I was just like everybody else in the room. I was scared. I wasn't sure. I was second guessing. I had to take the time. So I just wish that more people could be like Penny and actually put your case across in the way that you put it across, respectfully, you know, with as much knowledge as you have. We couldn't ask for more. I could be wrong, but we could not ask for more, really. Thank you.
Can I just comment there as well, please? Penny, I just want to echo what's just been said. So much respect for your candor. Again, I would want you next to me. So that's just, and for having the faith to be as open and honest in a safe space. So thank you so much.
And if I can come in, Penny, I do much respect, actually, because we want this to be a debate, not a one-sided conversation. And it's really helpful to have your point put across in the way you did. So I really appreciate that. Thank you. I have popped into the chat an article I found helpful about how they were able to manufacture this vaccine so quickly. Carol, I noticed that you've said this is what they want us to see. So I think maybe just read it first and see if it is plausible, because that's part of it. If you read something, you think this is believable or not believable, that I think helps address some of the questions that are raised. And I would just echo what Bolanle has said. We learned a lot about COVID as we went along. I remember colleagues sitting telling me they couldn't taste, they couldn't smell, but we didn't know it was COVID. It took us a long time to learn, and we continue to learn. And what we want is what you have done, Penny, that for people to sit down, look at the evidence, understand the evidence, and make an informed choice. Some of those choices take a little bit longer. Some of those choices are influenced by our personal stories and by the things that we have seen and by our own risk factors. And we want people to own all of that in order to make a choice for themselves. That's all we're asking. And lastly, I would always want us to build on what's strong, not what's wrong. Because the comment about nobody has ever built for us as Black people to move forward, that's only so far. Let me just say to you all, at the end of last year, I was a different person. I've always been Black, I've always been strong, I've always been female, I've always been proud of that. My parents brought me up that way. As at the end of last year, I was emboldened. And I was emboldened because of what happened with George Floyd. I was emboldened because of what I was seeing with COVID. I recognize the importance of standing up and speaking. And therefore, I am not going to spend time telling anybody about what's been wrong. I'm going to build on what is strong, and I'm going to keep moving forward in this space. That is what I'm looking around the room today. I'm looking at the amazing voices that we have to make a difference to the narrative moving forward, because we can't change what's gone behind us, but we do want to have a debate. So Ben, Penny, thank you very much for sharing your position.
Thank you, Penny. Thank you, Dr. for answering. We have Elsie. Elsie, do you want to go next and ask your question? Yeah, go ahead, Elsie.
Right. Yeah, my question is, in the press recently, they've been talking about priority of people with asthma. They're prioritizing the asthma. If you're on steroids, you can have the vaccine, but if you're not on steroids, you don't have the vaccine. Why is this? Hello?
No, I've been talking a lot, so I was waiting to see if Bolanle wanted to come in.
Can I just quickly give my disclaimer that I did not go back to the front line last summer for personal reasons. And I literally went back into working clinical pharmacy in a private hospital last November and December. So I actually do not know the answer.
Sorry, so let me come in with the priority groups, the 9 priority groups, and what they've tried to do is to go with the relative risk of you having really severe consequences. Many people have asthma, but not many people have uncontrolled asthma. And in order to try and distinguish between, just it's horrible to use the word common garden asthma, isn't it? Those with severe asthma versus those with mild or moderate asthma, they talk about those who need steroids. So those are people who are more likely to suffer a severe infection that may require them to go into hospital. That's how they've used that to help distinguish. But I would always go with the full picture. So there are other risk factors. So as we move into priority group 6, and I make no judgment because I can't guess how old you are, I'll just tell you what the priority groups say. Priority group 6 includes adults aged 16 to 65 in an at-risk group, which is the asthma conversation. Priority group 5, higher risk group, is those who are aged 65 and over. Priority 4, 70 and over, or clinically extremely vulnerable. Priority group 3, 75 or over. I don't know how old you are, but as we move down, we get to priority group 9, which is those 50 years of age and older. So eventually and quite rapidly, hopefully all of us, so I'm not quite 50 yet, but most of us on this conversation will be approached.
All right, thank you.
Okay. Esther, you had your hand raised. Do you want to ask your question, Esther? Just waiting for you to unmute. You there? That's it. Yep.
This coronavirus been around since before 2012. According to a leaflet I've got here from Virgin Holiday, 2019, we went to Sri Lanka, and this was in the packet about the coronavirus, about washing your hands and the distance and everything is on this leaflet. And when I came back in December 2019, I was very, very ill in bed. And friends have said to me, you've had the virus. So I don't know. But I just want to let you know that this virus been around for quite a few years, and it's just saying it's just, I've got the leaflet here all about the virus. So
Esther, I'm impressed that you have a leaflet from 2012, but I'll keep that comment to myself and I'll move forward.
No, it's not, no, I was given this in 2019, but this was printed in 2012.
In 2012, okay. Yeah, lovely. Good question, Esther. So a couple of things. It is possible and even likely that you might have had the virus in December 2019, because we know this hit the world screen closer to February in China. Yeah. But there was probably the beginnings of it happening internationally before that. It's only when it came to our attention.
Yeah.
I just want to give everyone a virology lesson. Viruses belong to families. The coronavirus is a family of viruses that look like a crown. So it's not one virus. There are many different coronaviruses. And coronaviruses have been around for a very long time, and they would cause, similar to the adenovirus, a common cold. That's what they used to do.
Yeah.
This particular version of the coronavirus has changed, and it's become something that is different, that is new, and that has caused a lot more spreading and serious infection. So this is a new virus that is derived from the coronavirus family. So it was around in 2012. It's not something new. It's not something hidden. It's a new variant, a new, and it's actually, sorry, to use the word variant probably distracts everyone. Because viruses change, they change in different ways. They change in kind of a big step, and we call that antigenic shift. They move into something different, or they can change in little ways, and we call that antigenic drift. And so when we're talking about some of the variants we're seeing just now, you're seeing just a drift, little changes in the virus over time. A significant change is called a shift. So coronavirus is a common virus that has caused the common cold, has been around for many years, but what we're talking about is a significant change in that family of virus to cause a new virus, which has caused us a lot of bother.
You okay? Are you okay, Esther?
Yes, somebody at the door. Can hear somebody knocking.
Okay, Lisa, we are fast approaching 4:30, so we are on 4:22. Could we just take a couple more questions and then?
Yeah, we've got Charlene. She's had her hands up for a while waiting, so we'll go to Charlene next.
Hello,
Charlene,
can
are you there?
hear me?
Yeah. Thank you.
Yeah, can you hear me?
Yeah, we can. Go
Firstly,
ahead.
thanks very much for this. Thanks very much for this forum. It's been highly informative and I've learned a lot. I just wanted to ask a question because it's taken me quite some time to persuade my parents to get the vaccine. They've been very sort of compliant and following the rules with sort of staying in. And my mother suffers from a condition called ankylosing spondylitis, which is essentially an inflammatory autoimmune condition, which is like a form of arthritis. And she has just coming up to a year been injecting herself with a biological agent which lowers the immune system. It dampens the immune system, and she's quite skeptical about the virus. And I just wanted to ask your experience with whether or not it would be safe for her to have the vaccine.
So it's a good question, Charlene, and thank you. I mean, your mom must be feeling so anxious. So the guidance we use around the COVID vaccine does not prevent her from having it. What we would say is that you should always discuss with your specialist, because what I don't know, and it's not right that I do, is the details as to how suppressed she is. What we are also saying now is that anybody who's about to start the sort of biologics or antibody treatment that your mom is on, we try and vaccinate them before, so they don't even have to have this conversation. And if there is a schedule of treatment for your mom, depending on the interval between her treatment, it may be helpful to try and vaccinate her within that interval. So there's some options available. So there's nothing that says she cannot have it. How we give it to her and the timing is something that should be discussed with the specialist. Does that help?
Yeah, great. Thank you very much. Thank you.
Who else had their hands up? Unilee, did you have a question that you wanted to ask? Unilee?
Thank you, Lisa. Thank you.
You're welcome.
Yes, I just want to know what's the logic behind the booster they're talking about for the autumn, and who will be getting this booster?
So with our bodies are wonderful creations, and just not talking about COVID for a minute. You always used to say that you should let your children play even if they're playing in the mud, because it will help their immune system. By exposing them to a variety of different germs, your body produces antibodies against a range of germs, and that means that if your body sees the germ again, its ability to produce a higher level of antibody is magnified because it has memory for antibody production. And in order for us to maintain that memory and or adjust to any changes in the type of germ that is out there, we sometimes use additional shots, which is similar to, if I look at the flu vaccine, for example, you know, we give a new vaccine every year because there may be slight changes or significant changes that mean we do need to adopt that approach. So this is about helping your body to maintain its memory, to produce higher levels of antibody should it be exposed to the current version of the virus that is around. Does that help?
Thank you. Who will this booster be aimed at?
So I don't have that information right now. I can try and find out for you specifically, but I think the JCVI, which is the body that sort of determines these things and states the order, the priority, the approach, will be giving further information. I don't have information on that at this minute.
Okay, thank you so much, Doctor.
Okay. We're going to go to one more question, which is Millie. Any questions that are not answered, if you'd like to email into us, if you know, you can email into the BME forum and we can try and answer them on another platform or another day. But we've got Millie. Millie?
Yes.
Yeah, do you want to go ahead with your question?
Yeah, can you hear me?
Yes, we can.
Hello? Okay, good. My question is about long COVID, because people who've had the virus and recovered, and then they can have symptoms off and on for months. When would they be taking the vaccine, given that they've got ongoing symptoms?
Guys, you guys have kept all the best questions. Thank you, Millie, for that one. So just to spend a minute on long COVID, many people with any viral infection may end up with symptoms that last a long time. Some people end up with chronic fatigue after some viral infections. And there's certain viruses that are more likely to give you those long-term side effects. And COVID has turned out to be one of those. So one is to acknowledge what long COVID is. In terms of long COVID itself, that doesn't stop you from having the vaccine. The things that would stop you would be if you were systemically unwell. And by that, I mean that you have a fever. You're not well in yourself. You're lacking in appetite. You're losing weight. You're unwell in a way that affects the entirety of you. That goes beyond some of the symptoms of long COVID, which include things like fatigue, things like tingling, things like continued alteration in taste. So it's if you were unwell with a fever, sweats, those sorts of symptoms that would stop you from having the vaccine. Having long COVID itself doesn't stop you from having it. As long as you're roughly 28 days from an acute infection of COVID, you can have your vaccine. Millie, I hope that helps.
Brilliant. Thank you so much. Lisa, thank you so much for taking the questions. Was your question answered to the last person who asked the question? Yeah.
Oh, yeah. Millie, was that helpful?
Millie? You've put yourself back on mute.
Yes, okay. Thank you.
Thank you. Listen, everybody, thank you so much for joining us today. Some fantastic questions that you guys had there. That was absolutely amazing. If you did have a question and you weren't able to get your question answered today, we do apologise. There is another event coming up on the 17th of March about the vaccines. So please do book yourself onto that event the same way that you may have booked on today, by going to Eventbrite and looking up Croydon BME Forum. If you are already connected with the forum, you will probably see the promotions that come out for this event. So please do join us with your questions for that event. I just want to say a huge thank you to Dr. Nnenna, to Bolane, and also to Patsy for giving your time today and coming here as professionals and sharing with us your experiences with regards to the vaccines, the coronavirus, and we really do appreciate it. And also, we want to appreciate those of you who attended and had the courage to answer your questions. Penny, amazing. You know, it's really great that people are able to make their own decisions based on factual information, and that's why the forum is here. we want to bridge those gaps to make sure that people are able to get the information that they need to help them make decisions. But we don't in no way want to force you to make any kind of decision. Just before we go, want to get Epiphany to speak a little bit about this group, because they do run this group every week, and they do some amazing work reaching out to our over 55s. So if you guys could just give us just one more